Coronary artery disease is the buildup of plaque in the arteries that supply blood to the heart, called the coronary arteries. There are many types of plaque, and plaque can obstruct blood flow to the heart. And the biggest worry from this, besides a heart attack and angina or chest pain with exertion, is the possibility of sudden cardiac death, which in many people can be the first symptom or sign from coronary artery disease.
Well, there can be a variety of different presentations for coronary disease or a heart attack, and typically the most common thing is some form of chest pain or pressure. This can be across the front of the chest. It typically comes on slowly as a deep-seated ache type of pain. It can radiate down into the arms or into the neck, the back, and so forth. It can be different for men and women, and so any type of symptoms like this should be checked out and you shouldn't ignore them. Oftentimes people think they're having indigestion and they're actually having heart disease symptoms. So if you have symptoms like this, especially any type of chest pain, any type of symptoms that would be accompanied by shortness of breath, sweatiness, even a cold sweat, those are the symptoms that could be coronary artery disease and should be checked out.
Otherwise, cardiac disease can also present as a heart attack. And a heart attack can be a sudden onset of crushing substernal pain right in the center of the chest that also can radiate to the neck or arm. And this is a more serious form of coronary artery disease which can lead to heart damage. And so if you develop resting chest pain, which by the way may also be associated with sweating, shortness of breath, or nausea and vomiting, certainly call 911. And lastly, coronary artery disease can certainly present with sudden death. So we certainly want to prevent this disease and identify it early. The folks that are at risk for coronary artery disease and the complications from coronary artery disease have been well studied over the years. Typically, these are middle-aged people or people who are of more advanced age, 50s, 60s, 70s. These are people with certain risk factors that are well developed as well and well identified.
These would include things like high blood pressure, high cholesterol. Diabetes is a very strong risk factor. Smoking is a strong risk factor for coronary disease. There are also things that we don't have much control over, such as our genetics. There are lifestyle changes that people can make. People that are sedentary or overweight, they can undergo a lifestyle modification to change these things.
While coronary artery disease certainly may not be completely curable, it can be prevented, or the complications and the outcomes from coronary artery disease can be slowed. The methods that we do this are to identify those at risk at an early time frame and to control their risk factors very, very aggressively so that we might prevent and or slow the progression and potentially eliminate the complications. The most important thing regarding lifestyle changes to treat and or prevent coronary artery disease is exercise, proper sleep habits, and paying attention to your diet. So eating the appropriate foods, reducing red meats, eating lots of fish, vegetables, and fruit, and getting out there and walking. The most important exercise that we as humans can perform. In addition, there are many medications to treat the risk factors associated with coronary artery disease, and while we do not recommend these medications to everybody, certainly seek the attention of your physician to see if you're a candidate for them, and they include aspirin, high blood pressure medicines, diabetic medicines, and medicines to reduce cholesterol. A CT scan is one of the very most influential tests of the last decade. A CT scan, which is also known as a CAT scan or a computed tomographic scan, is a series of X-rays that rotate very, very quickly into the patient. These X-rays then generate an image on a computer which is reconstructed, and a three-dimensional image of the heart is formed on a screen, which can then be evaluated in an infinite number of planes so that we can search through the heart any number of ways. And coronary artery disease has become one of the diseases that is most easily and effectively diagnosed with computed tomography. And one of these tests is called a calcium score.
We have a special type of CT scan called a calcium scan or a calcium score, where we can use this type of technology to image the amount of plaque in the coronary arteries and generate a number, which is a calcium score, which is related to how much calcium or plaque is in the coronary arteries.
If we do detect calcium by the CAT scan, then we want to get onto and treat their risk factors very aggressively so that we can prevent and or stop the complications of this disease. While we at Ohio Heart take radiation safety very seriously, we do not prescribe or recommend diagnostic imaging tests that expose patients to radiation unless we really feel they need them. The Ohio Heart and Vascular Center and the Christ Hospital enjoy a great expertise in cardiac CT scanning. In fact, we run courses to train physicians from all over the world in this technique, including physicians from Australia, Egypt, Europe, all over the United States and India. In addition, the Ohio Heart and Vascular Center and the Christ Hospital have access to clinical trials in cardiovascular CT scanning, including a very prominent trial ongoing now called the PROMISE trial. By having access to these trials, patients certainly enjoy a greater benefit because these trials will certainly help with their care and answer very important questions about the field.